experience so that you understand the perspective that I'm presenting today. I grew up in Canada and I trained as a mechanical engineer in Toronto. I've always been fascinated by cultures different to my own. So after a 7-month internship in rural Uganda, that really actually profoundly influenced my career direction. For my master's research in biomechanics, I spent a significant amount of time in India, which was followed by a PhD in biomedical engineering in South Africa. And it was there that I connected with members of the International Society of Biomechanics, and I've had the privilege of working with researchers from developing countries to address their challenges in conducting research relevant to their own communities. My presentation today is based on all of this experience, including both formal and informal training in the field of global development. And so I may make some generalizations for clarity, but I would welcome any comments, especially personal insights that you may have on any topic that I address, and would really welcome feedback from you at the end of the presentation. Okay, so just a quick outline of what I'll be talking about this morning. Morning for me, afternoon for you. I'm going to give you some background into the problem, which most of you are well aware of, I'm sure, and really discuss whether biomechanics research is worthwhile in developing countries. And then I'll talk about, I'll use some examples to discuss why and how we can benefit from biomechanics research in EDCs. And when I say EDCs, I mean economically developing countries. That's the term that we use at the ISB. And that these benefits are not just useful to those people living in developing countries, but also to all of us globally. And finally, for the last part of my presentation, I'll look at the challenges of research, conducting research in EDCs. Okay, so this is a word cloud that I generated from the ISB database using entries from members' area of work. And from this representation within the ISB, and also from similar organizations as well as publications within significant journals, we know that the majority of biomechanics research is being conducted in industrialized countries. And what I'd like to explore is how and why, if at all, the biomechanics questions that are being addressed in developing countries differ from those in developed countries. Okay, so here I've taken the most commonly used words by researchers from both EDCs and non-EDCs to compare their importance, simply measured using word count. So it's kind of a crude measure, but it'll give us a little bit of insight nonetheless. And what's interesting is that the most predominant area of work of our ISB members seems to be in the field of sports. And this holds true for both EDCs and non-EDCs. And use a pointer here just to point that out. So in sports, the green is non-EDCs, blue is EDCs. So we know that most of the work in sports is happening in industrialized countries, but when you compare what's happening in the non-EDCs across this spectrum here, we can see that most of the research is still being conducted in sports. And the areas in which the relative focus differs by geography is actually in modeling, which is primarily undertaken in developed countries, and also movement and clinical areas of research. And movement and clinical areas of research were had greater importance in EDCs when comparing with other research areas and taking into account relative proportions between the regions. So if we consider clinical biomechanics, and that is generally about treating patients, while instead modeling may have a less direct or immediate link between health improvements and the actual research that's being conducted. Even from these crude data, we can see that researchers in developing countries are reacting more directly to health concerns than their counterparts in industrialized nations. So one of the factors that influences a research agenda is, of course, funding. And this might account for the importance placed on sports-related biomechanics if you consider the investment that's made into professional sports just as a beginning point when we're thinking about financial investment into one particular field. But if we assume that the United Nations Millennium Development Goals are a good representation of low-income countries' health concerns, it looks like biomechanics researchers' priorities are not well aligned. So even if we focus on the goals that are obviously health-related, and we look at, oh, sorry, we've gone a bit too far, reducing child mortality, improving maternal health, infectious diseases, it appears that biomechanics research isn't really well aligned with priorities in developing countries. And so the question is, how do we get funding for biomechanics research in developing countries then? But then again, if you look at disability, sorry, just going back to my notes, the story is a little bit different if you look at disability. So disability was largely forgotten when looking at the Millennium Development Goals. And the Millennium Development Goals were established in 2000. And when we say disability, we're referring to all three, any or all three areas of functioning, including impairments, problems in, so that means problems in body function or alterations in body structure. That could be paralysis or blindness as examples. Activity limitations, so difficulties in executing activities. And that might be walking or eating as examples, or also participation restrictions. And this includes problems with involvement in any area of life. And that examples might be facing discrimination in employment or in transportation. And this area of disability is gaining global importance. So why do I say that disability is just as important as the Millennium Development Goals? Well, there is a growing body of empirical evidence from across the world to indicate that people with disabilities and their families are more likely to experience economic and social disadvantage than those without disability. And in addition, as other health priorities are addressed, for instance, prevention and treatment of infectious disease or violence, a greater number of survivors are living with the aftermath of these circumstances, often in the form of disability. So what are the causes of disability? The Institute for Health Metrics and Evaluation has an interesting online tool that you can access yourself if you're interested after the presentation, and it can be used to visualize and compare the global burden of disease by geography. So here we can see that the number of years of life with disability is predominantly caused by non-communicable diseases, which is shown in blue. So let's get the pointer out here again. So all of this blue area here is non-communicable diseases. And if you compare that with the red, which is infectious disease, maternal health, neonatal health, nutritional disorders, or if you compare it with the green, which is injuries here, you can see that even in developing countries, non-communicable disease is actually the greatest cause of disability. And the other thing I wanted to point out is that musculoskeletal disorders, which is in this box here, where's my arrow? There we go. And musculoskeletal disorders including low back pain, neck pain, osteoarthritis, rheumatoid arthritis, actually counts for one of the largest causes of disability within that blue box of non-communicable diseases. Okay, so if we compare the same plot for developed countries, we show that the non-communicable diseases makes up an even greater proportion of years of life with disability, and those affected are predominantly in the 45 to 60 year age range, so here. And the greatest risk factor for musculoskeletal disorders in developed nations is high body mass index, so obesity, which is probably well known to most of you. So if you play around with the GBD compare tool online, you can actually isolate each of these contributors to see the age at which populations are most significantly affected. And it's not surprising to know that osteoarthritis and rheumatoid arthritis increasingly affect you as you get older. Back pain generally starts a little bit earlier. And neck pain is dominant in the 45 to 49-year age range. So if you compare the same data for developing countries, we see that those affected are significantly younger. And so this is typically in the 30 to 50 year age range. And the reason for this is that risk factors for musculoskeletal disorders in developing countries include first occupational hazards, followed by obesity, high body mass index. So by looking more closely at what is happening to population health around the world, and going back to our list of research areas in biomechanics, it becomes more evident that biomechanics may actually have a greater role to play in addressing health priorities in developing countries than we may have previously considered. Oh, we're moving too fast here. Sorry. I'm going to go back a minute. There we go. Okay. So now that we understand that musculoskeletal disorders are a significant cause of disability in developing countries, that generally affect people at a younger age than in developed countries, and knowing that this often leads to poverty, I'd like to use a few examples to illustrate how biomechanics research can address the needs in EDCs and also benefit us globally. So first we'll look at how biomechanics can highlight the risk factors associated with the disease in developing countries. Then I'll explore ways in which biomechanics can improve treatment related to disability, focusing on both technological devices and therapy. And finally, I'd like to emphasize how addressing these issues in developing countries will also positively influence our quality of life in developed countries. And I'll use musculoskeletal disorders as an example, in part because it's such an important cause of disability, but mainly because it's my own area of research. And so I don't mean in any way to imply that biomechanics is restricted to this area of health. It's just the example that I'll use for this presentation. Okay. So as we saw in one of our previous slides, back and neck pain account for almost 14% of all causes of disability in developing countries, with occupational hazards generating the greatest risk. And transport injuries are a major risk factor. For any of you who have had the chance to compare typical traffic in urban centers in developing versus developed countries, it's pretty clear how this can be the case. But there are also less traumatic activities that are performed on a daily basis that contribute to these musculoskeletal activities. So in many parts of the world, including Africa, Asia, and South America, head loading is a common way of transporting goods, such as water and firewood for cooking. This is often considered a low-status activity and one primarily carried out by women and children. Normal loads range from 25 to 35 kilograms, with up to 60 kilogram loads reported. And it's also typical to see pregnant women or women carrying babies on their backs while carrying these loads. So several clinical studies have found that women carrying heavy loads on the head are at greater risk of developing degenerative and postural changes in the spine. And in 2011, Erica Bocage-Gavreau, working with Professor Dumas at Queen's University in Canada and Professor Lawani in Benin, conducted a biomechanical study of trunk posture comparing pregnant and non-pregnant women while walking with loads on their heads. Loads were 20% of the subject's body mass. They used inclinometers called virtual corsets, and they secured these at the C7 and sacrum levels of the spine to measure flexion extension and lateral bending angles. They concluded that upper trunk motion is reduced to balance the load carried on the head, and motion at the sacrum is increased as a way of compensating to allow for normal gait. And they also indicated that the associated musculoskeletal demand was higher for pregnant women, and that these deviations from normal can lead to fatigue and injury. So it's not uncommon for children in many developing countries to perform demanding physical tasks. And since this webinar is being hosted in Brazil, I did a quick search to see what I could find on this topic in this region. In 2005, researchers published results from an epidemiological study conducted in a low-income region of Brazil, and they found that work activities commonly undertaken by children increased risk of neck and back pain, similar to what we saw in Africa, and this often results in limitations of other activities. So although this study was able to make associations between type of work and anatomic site, we know that biomechanical studies such as the one conducted with women in Benin are better able to determine the direct link between activities and health outcome. And as a result, more appropriate preventive strategies can be designed for these populations. So these strategies are not limited to biomechanical applications either. They could be anything from improving roads in order to facilitate transport by means other than carrying loads on one's head, to creating programs that could alter body mechanics during high-demand tasks. Okay, sorry, I think just going to go back a second here. So this brings us to our next topic about how biomechanics can be used to improve not just prevention but also treatment of health issues that prevail in developing countries. And this map shows us the incidence of spinal cord injury by region according to the World Health Organization. One thing that I found extremely alarming is that people in the western part of sub-Saharan Africa have an 83% chance of mortality within 10 years of acquiring a spinal cord injury. And the causes of death following spinal cord injury in developing countries are often easily treated, for example, pressure sores. This doesn't happen, however, because healthcare resources such as assistive devices are not available. So pressure sores could develop as a result of constant pressure, which reduces blood supply to the skin and surrounding tissues, and may be prevented by changing position. So wheelchairs can be designed to permit a change of position by tilting the seat. But the design of assistive technology, like wheelchairs, must not only address the health requirements, in other words, be functional, but it also has to be suitable for the environment and the user. In developing countries, in addition to being affordable, technology has to be culturally appropriate. In regions of the world like India, where daily occupations are often performed on a floor, the assistive device, in this case a wheelchair, must also permit these activities. So like wheelchairs, prosthetics and orthotics are given much attention by donor organizations, where trauma due to landmines and natural disasters are a major cause of amputation in developing countries. These design requirements listed in the previous slide also hold true for prosthesis design. It must be suitable for the user and appropriate for the environment. And one of the most well-known prostheses for people in developing countries is the Jaipur Foot, which addressed these issues well. It was first developed in India in 1975 to treat trauma victims as well as polio and diabetes patients. The cost of the prosthesis is only about $30 US. It's made of durable materials that are waterproof and can withstand environmentally challenging terrain. And the three-dimensional ankle range of motion allows the user to squat, kneel, and sit cross-legged and more easily walk on uneven ground. So while the majority of testing on external prostheses is field testing on patients who have been using the device for extended periods of time in developing countries, biomechanical testing has further exposed limitations in performance. Subsequent designs have tried to address these inadequacies, for example using foot mechanisms that have energy storing and releasing capabilities. And the Niagara Foot, shown on the left, is an example of a prosthesis that has been designed using biomechanical principles to mimic normal push-off force. A specially designed keel and ankle system stores energy in early stance and releases it in late stance with the intention of decreasing muscular effort. In his review of lower limb prosthetic technologies, Jan Andrusek implies that the design requirements for developing countries conflict. In particular, he's referring to the biomechanical properties, in other words, performance and durability. So a great innovation would therefore be a design that can improve functionality while remaining inexpensive, durable under harsh environmental conditions, and culturally appropriate for the user. So biomechanical analysis has similarly contributed to improve the design of orthopedic implants, typically used to treat patients with severe osteoarthritis. Earlier, we saw that osteoarthritis was one of the leading causes of disability worldwide after back and neck pain. And the risk factors for osteoarthritis are probably common knowledge to many of you. They are age, obesity, trauma, and physically demanding occupations. I also indicated previously that road injuries and daily activities such as carrying heavy loads contribute to disability, and farming is actually one of the highest relative risks for. What I also want to emphasize is that although life expectancy is generally higher in developed countries, EDCs are catching up. So that's really important when looking at age. And this is also true of body mass index. So even though we might typically think that malnutrition in developing countries is equivalent to undernutrition, obesity is actually becoming a huge problem in developing countries with globalization. So joint implants are considered to be an effective form of treatment in developed countries when OA can no longer be treated therapeutically. And among non-Western populations, many activities of daily living require higher rates of hip and knee rotation than was previously permitted by implants designed in North America and Europe. When patients realize that they're no longer able to perform certain activities, such as kneeling for prayer or squatting for toileting, many choose to live with the pain of osteoarthritis rather than receive a deficient implant. In cultures such as my own, stair climbing is the activity that generally requires the greatest range of joint flexion. So it's about 85 degrees at the knee and 68 degrees at the hip. In a study that I conducted with colleagues in India, we demonstrated that far greater ranges of flexion are needed to squat and kneel and sit cross-legged. So you can see up to over 150 degrees at the knee for squatting and almost 100 degrees at the hip, again for squatting. When compared with a typical prosthesis that was available at the time, it was obvious that these assistive devices would actually impede movement in these patients rather than facilitate it. Okay. Beyond generating simply the maximum flexion angles needed to perform these activities, we were able to collect three-dimensional kinematic and kinetic data that could be used to improve functionality of the implants. And so I had a video here, which unfortunately I can't show you, but it was just showing a subject squatting with her heels flat on the ground. And all I wanted to show was just how natural it was for her to do this, as opposed to myself, who would have difficulty with this activity. And from the knee data, the important thing to get from here and from the moments graph is that, first of all, we have internal-external rotation shown in red that accompanies high flexion. And also, the peak knee moments were generated at this point. And these attributes have to be accounted for in order to improve implant performance for people who require these high range of motion implants. So these benefits of high range of motion orthopedic implants extend beyond non-Western populations. In developed countries, people are getting implants at a younger age and are demanding greater functionality for stretching or exercising, for example, or to perform activities that require a greater range of motion, such as gardening. So next I wanted to look at biomechanics and therapeutic treatment of musculoskeletal conditions, and in particular, how we can benefit from traditional practices originating in regions of the world that are still developing economically. So yoga is one example. Yoga originated in modern-day India, and Tai Chi is a Chinese martial art. And these practices have been around in these parts of the world for centuries and have only been more recently introduced to Western countries. Okay, so since then, the use of these practices to treat specific health conditions has been studied by researchers in various fields worldwide. Specifically, work has been published on the effect of these practices on fall prevention and balance, Parkinson's disease, musculoskeletal pain, osteoarthritis, rheumatoid arthritis, muscle strength and flexibility, and diabetes, among many others. However, due to the lack of robust scientific evidence, clinicians have an incomplete understanding of the adverse effects that may result from incorrect use of these practices. So an example of how biomechanics research can be used to address this is Dr. Rajani Muller-Paton's work in Mumbai. She's interested in using inverse dynamics, the inverse dynamics approach to determine which yoga postures are safe and effective when treating patients with certain conditions like osteoarthritis and back pain, or for those who have special circumstances such as being pregnant. And now that these practices are becoming more common globally, using biomechanics to unravel how and when they may effectively treat or prevent certain health conditions will benefit populations around the world. So now that we've looked at why biomechanics research is worthwhile for people in developing countries, and we look at specifically showing that it highlights the health issues by more clearly connecting risk factors with health outcomes, and it can also improve treatment, for example, through rigorous evaluation of assistive technology or analysis of traditional practices used for physiotherapy. So we talked about yoga and Tai Chi. But it's also important to recognize the many ways in which this work is worthwhile for the rest of the world's population too. And so gaining knowledge of ways to reduce cost of treating patients is one. Probably more importantly, I would say, is improving performance, whether it can be range of motion of joint implants or developing more robust functional assistive devices. Those are going to benefit everybody around the world. And although certain risk factors for non-communicable diseases may be unavoidable in developing countries, like the example that I used of carrying loads on one's head because roads are horrendous for other means of transport, some of us in developed regions may not have to worry about this, but there are also many lifestyle choices in developing countries that may both prevent disease and improve treatment. And so by better understanding the biomechanics of these practices, we can all improve our lifestyle choices no matter where we live. And I think that's a really important consideration when looking at biomechanics research in developing countries. So now I'll move on to the last part of the presentation about some of the challenges that biomechanics researchers face in developing countries. And I've grouped these into a lack of resources, so financial, material, and expertise. And I also wanted to include language as a separate issue because it's also a very significant challenge for many researchers. Okay, so in terms of the financial resources, we know that money for research in developing countries generally comes from national granting organizations, or national granting agencies, international organizations like the World Health Organization and the World Bank, or private foundations like the Bill and Melinda Gates Foundation. Probably less common would be money coming from industry, which would be a better source in developed countries. So as I described at the beginning of the presentation, the priorities of the international funding agencies that generally have more financial resources than governments of developing countries, these priorities are largely related to the Millennium Development Goals. So infectious diseases, maternal health, nutrition, those kinds of things. In terms of material resources, that includes books, equipment, and the infrastructure around that equipment. Research programs often lack up-to-date books and journals, and importantly, the books and journals that are available are generally written by experts in industrialized countries for students from their own cultures. and this can make it especially difficult for those from other cultures to connect with the material being taught. When looking at biomechanics equipment, again, the equipment is designed for labs in developed countries, and bringing this equipment to developing countries has numerous challenges associated with its use there. In addition to the cost, which can be tens of thousands of dollars for gate lab equipment, for example, it's often difficult to install, operate, and maintain due to harsh environmental conditions, including dust, humidity, and high temperatures. In addition, power can be unreliable, and replacing malfunctioning parts can often take months. An example of that last point is one of the ISB EDC labs in Venezuela. They had arranged for motion analysis to repair a malfunctioning camera, so they had a good relationship with manufacturer, and the ISB was able to help with that. But it actually took several months before they received government permission to temporarily export the cameras without having to pay duties. So you can imagine the challenges you'd have as a researcher if the camera you were using for a study were to malfunction right in the middle of your data collection. It wouldn't be a lot of fun waiting months for the camera to be replaced or repaired. And finally, most importantly, researchers have to have an adequate training to be able to operate and maintain the equipment. And that often takes years of practice with more sophisticated technology, such as some of the gate lab equipment. And all of these are significant challenges that have to be considered well ahead of planning research studies that require this kind of equipment. So in terms of the expertise, in developing countries, the lack of biomechanics research equipment that we talked about means that students in biomechanics-related education programs haven't been exposed to its use in practice. In other words, they might not be familiar with how the equipment works beyond possible theoretical knowledge. And so this results in a shortage of adequately trained technicians or researchers who are able to operate and maintain the equipment. The next question is whether biomechanics or related graduate programs even exist in developing countries, and that's another story. In fact, there are few and far between biomedical engineering programs in developing countries, which means that students who have the financial means have to attend a foreign institution for training. So as I mentioned previously, this means that they're exposed to teaching material that is generally not culturally appropriate for addressing the current concerns that they experience at home, and instead it's focused on health priorities in developed countries. So this is a list of challenges related to biomedical engineering expertise that was put out by the World Health Organization. And they talk about the limited educational opportunities in country, on-the-job training opportunities, and also limited opportunities for career advancement. Also the inadequate number of qualified personnel to fill posts, the absence of a national professional regulatory body, brain drain to higher income countries, and then also the competition with private sector for scarce skilled professionals. And that these issues are probably familiar to most of you who are watching. So this lack of expertise isn't limited to people from developing regions. In developed countries, the main problem is that researchers lack cultural competence in many cases. So they may have good intentions to be designing for people and populations in developing countries, but if they don't have a complete understanding of the cultural issues, they might not be able to adequately address them or conduct effective research. So next I wanted to look at language. And English is generally considered to be the main language of scientific communication. But of the 7 billion people on Earth, over 1.4 billion live in China alone. And according to one of our ISB colleagues, he said, 10,000 papers are published in Chinese journals each year that go unread by the majority of researchers worldwide. So for most of you who are watching whose native language is Portuguese, you are probably facing similar issues. And it's not an easy one to address. But how can we address some of these challenges? So in terms of funding for research, one of the important things, I think, is to demonstrate the impact of biomechanics research on both the national and international research priorities. And I talked a little bit about those connections and how disability leads to poverty, which is really one of the main Millennium Development Goals. And so biomechanics can actually hugely impact those MDGs. In terms of equipment, we've talked about within the ISB just starting with basic equipment that might be more robust and reliable and easy to operate and maintain in developing countries. And last week's presentation, if any of you saw that on Children's Gait, the presenter demonstrated that a lot can actually be learned from really basic spatio-temporal parameters. And this kind of research doesn't have to be less important. It actually can show very important biomechanical properties of the issue that you're looking at, and it can also allow you to build expertise that's needed for research that may require more expensive equipment. And once you have the expertise and can put the other pieces into place, then you can go on to that next step. And that's what I am referring to with number 2 on that list of organizing the big picture. So you have to make sure you have the expertise to operate and maintain the system. And this also includes financial and human resources just with lab management. And at that point, you can start looking at the material resources that you need. And the ISB community can be a great resources for finding some of those, the equipment that you need or other resources. And I also just wanted to mention here that Philippe and Marco Vaz are actually putting together a manual, I believe, to help researchers from developing countries get their research going, and I'll let Philippe talk about that a little bit more. That's something that they're hoping to have for next year, which I think is a great initiative. Okay, so then in terms of education, which is the third point here that I've got on the list, let's point that out here, where I'm going through. There are actually more and more online courses and free educational material. It's becoming far more popular every day, and I think that's great. And that includes also initiatives such as the webinar that Philippe has organized. So some examples of these massive open online courses, these MOOCs, are Coursera, edX, iTunes U, the Khan Academy, and they've got some really good courses. The problem is that they're not all, not very many biomechanics related, if any, actually. But for some of the basic physics and math that may be needed for biomechanics, they have a lot to offer. The ISB also, we're trying to get more and more opportunities to help researchers in developing countries. And that includes getting people to the international congresses. So the congresses provide an opportunity to explore the latest research directly from the experts. And at the congresses, we also have tutorials and workshops. And if you aren't aware, I'm sure you're aware of the grant opportunities to get you to the upcoming ISB Congress in Glasgow, so you can look at the website for more information there. Within the ISB, we also try and encourage regional symposia and help by supporting visitors from experts, visits from experts around the world to these regional conferences to present book donations. So the library at Unipampa is one example of that initiative. And the travel grants, so not just to the conferences, but also to other labs if you are interested in conducting research as part of your graduate work, for example, at another lab. And one of the last things that I wanted to point out there was the Hu Hinari program, which is a program set up by the World Health Organization together with major publishers, which enables low and middle income countries to gain access to one of the world's largest collections of biomedical and health literature. And I'm not sure if Brazil qualifies necessarily for that program, but it's certainly worth looking into if you're not already signed up for that. Okay, so next I also wanted to point out that there are a number of ways that researchers in developed countries can help improve this capacity for research in developing countries. And the first way is that they can also relate the work that they're doing to the international priorities that we looked at, rather than just looking at their own regional concerns. In terms of material resources, an obvious solution that may occur to some people is to donate secondhand equipment. But this has to be done with a lot of consideration in order to ensure that it's successful. And I've talked about some of the challenges with using equipment in developing countries. And this is true of not just biomedical or biomechanics research equipment, but all kinds of healthcare equipment. So this is a common problem that the World Health Organization has tried to address by publishing guidelines for healthcare equipment donations, which is an extensive document outlining what needs to happen to ensure installation, operation, and maintenance is achieved successfully in developing countries. In terms of education, I mentioned that there are only a few, if any, open access courses specifically related to biomechanics. So I think it'd be a great initiative if we could get together and design a massive open online courses, a course that could be offered through one of these platforms on biomechanics, and especially make sure that it's relevant to people in developing countries as well. And the last really important point I wanted to make here is that globalization is making it easier than ever to communicate remotely, as we're experiencing right now. And so I think we really need to continue taking advantage of this as much as possible to collaborate on problems and opportunities that, as you may have discovered today, may be more universal than you previously considered. Okay, so the last challenge is one that I pose to you, and that's really to identify the challenges relevant to your local community that could be addressed using biomechanics tools, and also to connect these to how they can benefit us globally. And so I'd like you to leave you with that, to let you think about that a little bit. And my last couple slides, I just have the references. I can send these to Philippe if any of you would like to look at specific things that I talked about today, as well as the resources that I talked about. And I'd really like to highlight the ISB and the web pages, the EDC information web page and student grants page, if you're not aware of those. And I've just got a list of some of the other ones that I mentioned in the presentation. And last but not least, I wanted to thank a number of people. So Kelsey Collins, she is the student representative at the ISB, and she did a great job of putting together the ISB database that I was able to access to look at the biomechanics priorities, and that was the word cloud that I generated from that database. So thank you, Kelsey. And then I also wanted to thank my ISB colleagues, a number of whom I mentioned throughout the presentation, and it's been very informative for me to be able to work with you, and I really appreciate everything that you've contributed, and especially Philippe Carpaz, who is constantly doing work that is benefiting not just us at the ISB, but regionally within Brazil and Latin America, and I think you're doing a fantastic job, so I appreciate that very much, and just wanted to say keep that up too. So thank you very much, and it'd be great to get some questions and feedback from you now, and I look forward to hearing what you have to say. Thank you.